So Workit Health is a company that I co-founded in 2015 with a close friend, Robin McIntosh. I'm originally a townie. I grew up in Ann Arbor. I went to elementary, middle, and high school here. I got 3 degrees from the University of Michigan. I'm very local. But after college, I moved to San Francisco. And before college, when I was between the ages of 15 and 22, I had a very serious addiction and had really hard time with initially drinking in high school and later more serious drugs as I got closer to college. And it's an addiction that I almost didn't survive. And I was lucky enough to get sober when I was 22 years old through the recovery community in this town. But as you'll see, I was one of the lucky ones, and there are many who are not. So Workit is a company that I started based on this idea that patient-led design is the future and that social enterprises will rule the future. If robots are going to take over all of our jobs, then it makes sense to work on a mission-oriented business, because a mission-oriented business still has passion in it. Even if you're sending HubSpot sequences and sales emails to people, at least you're doing something that's really like driven by something you really care about, right? So when I started this company, it had no money. I bootstrapped it for a year with Robin, who was my close friend from the recovery community. And now we have 35 employees. We've raised $3 million. We have a lot of successful partnerships with companies all over the country and really all over the world that cover the service, and it's been very successful. So it's been very exciting. But you know, why is this a big deal, right? So last year, more people died from the opioid crisis than the entire Vietnam War. So that's 70,000 Americans died last year from opioids. And in Washtenaw County, it looks like typically a couple a week, though last winter we spiked at 5 people dying a week in our county from opioids. So this is a local problem. It's a problem I care a ton about. And it's just crazy, right? Like Vietnam, people dying from drugs that were prescribed by a doctor or that they stumbled into after a surgery or after an accident. We shouldn't be in this situation, right? So there has to be a better way. The status quo is not okay. So why do I care about this? We started this company because over 40 people that we knew in the community and around our lives and in our families passed away from this condition. So it's very personal. And we're very passionate about what we do. So what can we do differently? We took our experience as patient-led designers and we mapped all the holes in the system, right? So I'm in AA. When people I knew relapsed, I had a hard time talking to them, but somebody needed to talk to them. So can we build a service that can talk to people who are relapsed, even though people in recovery are triggered by talking to them? Can we build a service that talks to people that don't identify as having an addiction, but are curious if they might, or it runs in their family? So we built 2 different programs, one that's online and is delivered anywhere, that lets people kind of work through their addictions at their own pace. And people get into that program who aren't even sure if they have an addiction yet. So we have teenagers that are just exploring whether they have the genetic makeup and whether the 3 blackouts they had in the first week that they drank, that's very similar to my path, were maybe a problem and something to pay attention to. And then we have people in our program that are executives and that are celebrities and that there's no way they would get sober if we weren't a private telehealth program that allowed them to work with us in their pocket instead of publicly in the community. And we built a program around all of those design constraints, because I had a background in design thinking and my co-founder had a background at IDEO, which is a kind of a famous design thinking firm. And we ended up with 2 programs, one that does a full medical detox online and another that allows people to kind of work through a program with a counselor at their own pace. And so we let people focus on whatever they need to focus on, right? Addictions, unfortunately, come in a merry bunch, so you don't just have one. I start with drinking. My drinking gets under control. Then my raging eating disorder comes right after that. So we let people, like college, major and minor on the things that they want to focus on. And as they get sober over time, those needs change and they get stronger. It's a beautiful thing. And then we give them access to a counselor in their pocket anywhere. There's a lot of millennials in our program. They don't like to speak on the phone. We've never spoken to any of them. They text and chat with their counselor. They go to group therapy through text, and they get the access that they need in the format that works for them. And then we provide site-based onboarding at our clinics in Ann Arbor and in San Francisco that allow people to get started that need to do medical detox and then work with us for 2 years online. It's really wonderful to sort of build programs that meet people where they are and then follow them virtually anywhere. And the people that like us and love us because we fit into the confidentiality that they really care about as part of their process of exploring their addiction, and we allow them to we meet them where they are and get them to where they're trying to go. So we have a team of largely Ann Arborites. A lot of us are cross-disciplinary. Many of us are in the recovery community, and we're doing this because we want a better world for people that come after us, that don't have to go through the incidences with the police or losses or sexual assaults that some of us have experienced as part of our road to recovery. And we're excited to meet you in the lower level of Spark. So we'll have a booth there. After you have your beers, you can come by and do some cognitive behavioral therapy with us, just to have that toolkit in your pocket if it's ever needed. It's not an issue for everyone, but 2 out of 3 Americans at some point in their life will have an addictive behavior. So it's most of you. Thanks a lot.